Hey friends, welcome back to my channel Hello Education with Komal. Are you ready? Time to launch.
YN News. Recently, the Rajasthan government has passed the Right to Health Bill, which gives every resident of the state the right to avail free services at all public health facilities. What are the key features of the bill? Free healthcare services, including consultation, drugs, diagnostics, emergency transport, procedure and emergency care, will be provided at all public health institutions and select private facilities subject to conditions specified in the rules. The bill makes it mandatory for the hospitals to provide treatment in emergency cases without waiting for medico-legal formalities and give medicines and transport facilities without charging money. The implementation of the law is expected to do away with out-of-pocket expenditure and bring transparency and accountability within the healthcare system. What is the right to health? About right to health refers to and means the most attainable levels of health that every human being is entitled to. The origin of the right to health dates as far back as 1946, when the first international organization, World Health Organization, came into existence to formulate health terms as human rights. The right to health is an essential component of human dignity, and it is the responsibility of governments to ensure that this right is protected and promoted for all individuals, regardless of their gender, race, ethnicity, religion, or socio-economic status. Part 4 of the Constitution, under the directive principles of state policy, ensures social and economic justice to its citizens. Therefore, Part 4 of the Constitution directly or indirectly relates to public policy in terms of health. Related provisions in India. International conventions. India is a signatory of the Article 25 of the Universal Declaration of Human Rights by the United Nations that grants the right to a standard of living adequate for the health and well-being to humans, including food, clothing, housing and medical care and necessary social services. Fundamental rights. Article 21 of the Constitution of India guarantees a fundamental right to life and personal liberty. The right to health is inherent to a life with dignity. TPSP, Articles 38, 39, 42, 43, and 47 put the obligation on the state in order to ensure the effective realization of the right to health. Judicial pronouncements. Supreme Court in Paschim Bangak Hitmas Ur Samati case held that in a welfare state, the primary duty of the government is to secure the welfare of the people, and moreover it is the obligation of the government to provide adequate medical facilities for its people. Also, in its landmark judgment in Pramanand Katara vs. Union of India, Supreme Court had ruled that every doctor, whether at a government hospital or otherwise, has the professional obligation to extend his services with due expertise for Supreme Court had ruled that every doctor, whether at a government hospital or otherwise, has the professional obligation to extend his services with due expertise for protecting life. Significance. Right-based healthcare services. The people are entitled to the right to health, and it creates a compulsion for the government to take steps toward this. Wide access to health services enables everyone to access the services and ensures that the quality of those services is good enough to improve the health of the people who receive them. Reduce out-of-pocket expenditure, protects people from the financial consequences of paying for health services out of their own pockets, and reduces the risk of people getting pushed into poverty. What are the challenges related to right to health in India? Inadequate healthcare infrastructure. Despite recent improvements, India's healthcare infrastructure remains inadequate, particularly in rural areas. India has 1.4 beds per 1,000 people, 1 doctor per 1,445 people, and 1.7 nurses per 1,000 people. Over 75% of the healthcare infrastructure is concentrated in metro cities, where only 27% of the total population resides. The rest 73% of the Indian population lack even basic medical facilities. High disease burden. India has a high burden of communicable and non-communicable diseases, including tuberculosis, HIV/AIDS, malaria, and diabetes.